Okay, let's see. Hey, good day, everybody. Welcome to the webinar. We are Proper Healthcare. In the next 20 minutes, you're going to learn my exact strategy on how to protect your health and wealth without using a traditional health insurance. My goal is to replace what's not working with something better. Now, you might be thinking I'm going to introduce a short-term medical plan or some limited medical plan or Christian-based sharing program. It's not. Those solutions require you to take on a little more risk for very little savings. The proper healthcare approach saves you anywhere from 50 to 70% on insurance, but more importantly, it promotes a more proactive approach to better health. You know, our present insurance slash healthcare system is very defensive. It's reactive. We wait till we get sick, then we pump our bodies full of medicine. Um, the proper healthcare approach is more of a proactive, age better, avoid illness to begin with, while saving a fortune on insurance. If that sounds appealing, I hope you'll be interested in our approach. My name is Charles Falgout. I am the founder of Proper here in San Antonio. I have a degree in finance, but more importantly, I have 30 years of concentrated study of the medical insurance field. Now, I've put my license here so you can verify yourself. In over 30 years of serving the population, I've had zero consumer complaints. Now, I also record these webinars for your protection and mine. I've got $1 million policy to ensure what I'm saying is backed up. Look, I dropped traditional health insurance from my family in 2016. It was one of the smartest moves that I've made. I hope this solution works for you, and if not, I pray that you find the right solution. Now, I'm going to try and make it entertaining, but health insurance and health care is, I know it's not the most sexy subject in the world, but it's a very important subject. And so I hope that you give me, at least 20 minutes of your undivided attention. I think you're going to love what you hear. Okay. All right, look, I'm going to get straight to the point here. If you want to learn about Proper's backstory and how we got started and why traditional model has failed us and what our cause is and what our values are, we have a longer version. But this one, I'm going to get right to the point. I'm going to discuss what health insurance is, how your money is spent. These are the 4 elements behind every catastrophic insurance policy, and I'm going to show you how you're going to be able to get each one of these benefits for a far lower price than you would with the traditional health insurance market. And finally, look, I'm going to make you an irresistible offer to join the Proper family. I hope you take me up on that offer. Look, when you buy a traditional health insurance policy, here is how your money is spent. Look, you're buying money to pay for the little stuff. We call that primary care. You're buying money to pay for the big stuff. We call that catastrophic care. Yes, you're buying their networks and you're buying their admin, but make no mistake, 70% of your money goes to support the little and big medical costs that are just going to happen. Look, our bodies break, viruses spread, accidents happen. You could be the most health conscious person in the world, exercise, eat right, live right, and just eat a bad taco. I've seen it. I've seen it happen to people. And so let's tackle the big medical costs right out of the gate, catastrophic care, what so many of us fear. And I'm going to go straight to a cost comparison, and I'm going to be the guinea pig. Look, when I dropped traditional insurance, they were charging me $1,300 a month for me, my wife, and my son. Roughly 35% of that premium, as the other chart reflects, goes to cover catastrophic care. So I was being asked to pay $455 a month. Whether I use it or not, that money was earmarked for catastrophic care. But today, I buy directly from the wholesale market. And with Proper, so can you. Look, I bought a policy that pays 100% of hospital and physician charges from $50,000 to $5 million for $54 a person. This represented a 64% decrease in cost for my family. And by the way, the wholesale reinsurance market, they're far larger, far more solvent than the retail boys ever would be. Of course, you're going to have to do your own math on your savings and your family dynamics. But look, I was saving, this one move alone saved me $293 every single month on insurance. But here's another thing I want you to consider. I could have saved the entire $455. You see, unlike traditional insurance that requires or it mandates that you buy everything, it's a package deal. With Proper, everything is an option. Look, for those of you that are on a real tight budget, this might be your best solution. I have members who are getting a far better use of their $54 than wasting it on a 1% chance bet. Now, let me be crystal clear here. With traditional health insurance, Obamacare, group health, you have one time a year to buy or not to buy. It's called open enrollment, and you can buy coverage without any pre-existing condition. And unless you have some special enrollment qualification, you can't buy traditional health insurance outside of that open enrollment. This ACA legislation change really threw a lot of people a curveball. But you see, with Proper, you can buy our catastrophic policy any first of the month without any pre-existing condition and without any health questions. And so Proper trims your financial risk from 365 days, one time a year, which I got to tell you, it's easy to get caught with your pants down, to 12 times per year, 30 days. What insurance agent can do that for you? So look, the benefits of ownership are simple: lower cost, lower risk, so maybe you can gamble with a little more confidence, and no pre-existing conditions either way. So look, for my family, I stopped gambling on the traditional retail health insurance model, and I bought directly from the wholesale outright. It makes me sleep better at night. But look, for those of you that want to use it as an option, hey, either way, you're going to save a fortune. If that makes sense, make sure that you click that button below, and let's have a conversation a little later on. Okay, so back to this. How is your money spent? Now we're going to tackle networks. For the last 2 decades, the traditional model, health insurance model, has told us what doctors and what hospitals that we could see. It's called managed care, HMOs, PPOs. And again, going straight to the cost comparison, I was being charged $130 a month, whether I used it or not, just for access to this particular network. With Proper today, I pay 20 bucks a month for what's called price transparency services. Now, some people call it an open market healthcare system. I'm saving $110 a month. I'm letting price and quality dictate where I'm going to go. I'm going to allow the market to compete for my dollars. Let me show you what I mean and how this works. So with Proper, you will have direct login credentials. You'll have your own username and password. So you can keep your health issues private. You'll be the hero for your family because at your fingertips, you're going to have real-time cost information that's gathered both by government as well as private claim payers. Here's just one example of over 600 common shoppable healthcare procedures. This one happens to be an abdominal MRI with or without contrast within a 25-mile radius of Schertz, Texas. And so here are all the medical vendors that market or provide that service. And so you could pay $600 or $6,832 for the exact same photograph. Folks, this is how ridiculous medical pricing is between vendors. And most of us are just guilty of going wherever the doctor recommends. Folks, trust your doctor with your life, but not with your finances. Now, the numbers in blue represent what Medicare pays that vendor for that particular service. And by the way, that's our starting point when we're negotiating on behalf of our members their bills. So look, I could talk long about the benefits of this. Bottom line, you're going to want this information at your fingertips. It's going to save you a fortune. Now look, the benefits of ownership are simple: lower cost, no more secret pricing, no network hassles. You're free to see whoever you want You get rid of all the network fine print in and out of network deductibles and co-insurance charges that, quite frankly, the insurance companies hide behind. You're going to get real price and quality information. You're going to end surprise billing issues once and for all. And the bottom line, folks, I mean, we give you control over the system. You should have control rather than the system controlling you. I mean, so many of us, we just have these plastic cards and we hand them to the ladies in the front and we just, blindly are treated, whatever. And then we're shocked when we have huge medical bills. There's a reason why that is the process. And I'm not going to share it with you today, but we certainly could have a conversation. Look, so solution 2 is stop buying traditional health insurance networks and take advantage of competitive pricing and let the medical vendors compete for your dollars. Look, competition works every time when tried. Let's do it in the medical field. If this makes sense, make sure that you click that button below and let's have a conversation a little later. So again, back to how your money is spent. Now we're going to talk about primary care. This is the little stuff. And guys, if you're going to use anything, this is the highest probability of use. And this, I got to tell you, this was the hardest nut to crack. But when we figured it out, this is what separates proper from everybody else. Look, this is your doctors, your labs, your x-rays, your medicines. This is what insurance companies have been running away from by blowing up your deductible year after year. And again, to go to a cost comparison, I was being asked to pay $455 a month. Whether I use it or not, that money was spent. And if I got sick or if I got hurt, I had to pay a deductible first. In my case, it was $7,000 for me, $7,000 for my wife. And that deductible resets every single year. I'm just renting my benefits. You see, so at Proper, what we say is, look, start owning your primary health care. Maybe insurance, which, let's face it, folks, it's a socialized system, is not the solution for the little stuff, not especially with the makeup of America today. I mean, I hate to say it, but I'm not going to participate in that socialized system. I make good choices. Look, I'm proud to introduce a banking product that was designed with insurance principles that truly rewards good health. Let me show you how this works. And so here was my family's exact comparison between traditional health insurance and what is today Proper. And in 2016, for all the little stuff, now remember, we covered the catastrophic, the big stuff already. Traditional insurance demands that I pay $455 a month. There's no flexibility. I had to pay $5,000 in premium, or I would lose it. If I had an accident or illness, I had to shell out $7,000 first before the insurance paid. And at the end of the year, I'm building no true value for my money. This is what I mean by saying that you're renting. With Proper, I chose to contribute $303 per month. Now look, there is complete flexibility here. You can choose to contribute more or less. I contributed a bit over $3,600, and by the year end, due to the matching principles, I would have almost $5,000 available for any medical expense. So I'm getting paid for being healthy. Now that was appealing to me because, to be quite frank, I've enjoyed pretty good health for 54 years now. And look, if I had $1,000 claim, which, is above past experience, okay, so maybe I've got 4,000 left over in my account and not 5. But I own this money. I'm not renting. Back to the traditional model. In 17, in 18, in 19, my premium would have just gone up. And I just assumed a 10% increase. Folks, that's being conservatives. There's no savings for good health. I had no flexibility. I either pay that premium or I lose my insurance, period. I would have spent over $25,000 still shell out 7 grand first before they ever paid anything. And by the end of the year, again, I'm not building any true security for my family. I better be able to work while I had that heart attack or that stroke or dealing with cancer. With proper, I continue to contribute the 303 per month. Now my matching growth really starts accelerating at this time. This is when the fun really kicks in. So by the end of the second year, I've literally doubled my money. Not quite, but pretty close. By the end of the third year, I've reached my target balance of 25,000. I'm paid up. I stopped making contributions. I only pay a small maintenance fee to maintain the 25,000. Look, it's a far better approach and a huge savings than from the traditional model. Look, I've paid a little over 11.5, but I have $25,000 sitting in my account. Here's my card right here. It sits in my back pocket. And it has zero deductible, covers first dollar expenses. That 25,000 is in my bank account. It's FDIC insured, and I can spend that money on any medical care that I want or I need. And here is a list of those covered services. It covers all medical, all dental, all vision, all pharmaceutical. Everything in gray is what traditional insurance typically covers. Now, the items in red are services traditional insurance does not cover. So look, doctors not elsewhere classified, folks. This opens up naturopathic physician, alternative medicine, medical services and health practitioners not elsewhere classified. This opens up bariatric surgery, plastic surgery, cosmetic dentistry, LASIK, fertility. I don't know if you've noticed this, but wellness centers are popping up left and right all over the more wealthy areas of San Antonio because they know that the traditional insurance doesn't cover their services. And so wealthy people have access to proven health strategies that unfortunately many in the middle and lower income are just left out. Folks, I'm going to be pretty bold here, and I'm going to say nutritional therapy works. Boosting your immune system so a virus doesn't hit you that hard is smart. Viruses affect the weak or they pursue the weak. Anti-aging care, oxygen therapy. These are services that provide our bodies, our minds to be youthful, energetic, productive. Let's start spending money avoiding illness. Let's start playing offense and win great health, not just throwing our money into this hole and playing defensive medicine and just waiting until we get sick. It's ridiculous. Look, real quick, here's an aha moment that I had that just got me excited about this. So when I reached my 25,000, I could have stopped. I could have paid the 53 maintenance fee, but I chose not to. And here's why. Because I moved from the 25 to the 30,000 platform. I got credit for the 25. It placed me right here in this contribution schedule. So I paid 370 for a little over 4 months, and boom, I was at 30,000. Again, I could choose to stop, pay my maintenance fee and be done with it, or move on. I moved on to the 40,000. I paid 485 for 6 months, and now I've got 40,000 sitting in my back pocket waiting. And look, I could keep growing until 60,000. I chose not to. I think 40,000 is sufficient for me. But you could if you had a lot of non-traditional care that you wanted. But okay, so look, the benefits of ownership are really long. There's no deductibles. There's no co-payments. Look, I want you to use those dollars to nip those issues as soon as they surface. High deductible health plans are worthless if you avoid care. Okay, anyway, no more asking permission, waiting 2 to 3 weeks for care to be authorized. This is a dirty little secret or trick that the carriers have been doing recently. Look, if I want an MRI or if I want something because I am in pain, I'm not going to call an 800 number and get authorization. I'm going to find the best, one that at the lowest price, and I'm going to pay for the service right there. No ownership, I'm sorry, full ownership. The dollars are matched. You know, folks, I was a big HSA advocate. You know, I had a lot of money into my HSA but because there's no matching on that, I dumped that and I went with this approach. Most importantly, I think though, is that you don't have to buy separate policies to cover, you know, dental, vision, hearing, you know, home health care, things like that. I mean, you can use your dollars the way you feel like you need them. So solution number 3, at least for me and my family, is I stopped renting my primary care from the traditional boys, and now I own my health with Proper. If that makes sense to you, be sure to click that button below so we can talk a little later. So winding down, how your money is spent. Last piece of the puzzle, admin. It represents 20% of your premium. So I was paying $260 per month, whether I used it or not, just on administration. And folks, I got to tell you, with 90% of the claims being auto adjudicated, meaning it's all done by computers, no human eyeballs are involved, why am I paying for all this middleman fluff? Look, the old traditional model makes me pay commissions and bonuses and overrides and trips and prizes to all the men and women in these glass tower buildings. You know, membership into our Texas non-for-profit association, it provides far more value for a fraction of the cost. Look, we don't auto adjudicate the claims. So the membership of $40 an adult, $20 a child, that's going to pay for a CPT code certified negotiator. These folks are trained in both federal and state consumer laws to assist our members in negotiating lower cost and paying insured claims. Because look, when you're sick, the last thing you want to do is negotiate. That's what our advocates are there for. Now, look, there are far more benefits of membership, and I'll get into that later. I was saving $140 a month from the traditional model. Now, you might be thinking, why has this strategy not been done before, right? Well, it has. I mean, big companies do much of this internally, but it's never been available to really small businesses or individuals at all. And look at our neighbor here, USAA, in our backyard. They're an association. They're not an insurance company. So they did it in the property and casualty field. But I'm going to tell you, 30 years in the business, health insurance was fair. You know, in the 80s, it was a bargain. In the 90s, it started, you know, projecting up. But here's the problem. The traditional insurance market, the brands that we have grown to trust, they got into bed with the government. Now, the executives for these companies, they're set. They have their golden parachute. Their families are going to be wealthy for many generations. But you and I are stuck paying the regulation. We're paying the expansion of Medicaid. We added 30 million people onto tax-subsidized Obamacare, which at the time, with 160 million, you know, people in the under 65 market to subsidize it, that was fine. But guess what? We now have COVID-19. We've lost 30 to 40 million people on the rolls that we're paying into the system. Now we have those, according to the Kaiser Foundation, those people are going to be able to get on this subsidized health insurance. So now we're going to go from 30 to 50 to 60 million getting some subsidy with only 110 million support. Folks, I'm telling you, it's going to implode. It's going to get so much more expensive when you get that renewal. You know, so many of us have just been paying for this. We're finally fed up. We're standing up, and Proper was born. I mean, I saw the writing on the wall in 2016. So look, you could continue buying an ACA-controlled Aetna, Blue Cross, Humana, United, and you're going to pay these mandatory fees year after year, and they're going to rise as you age, period. Doesn't matter what you do. Or you can join Proper, buy the options that you want, and more importantly, that you can afford. You know, my insurance renewal was $1,300 a month in 2016. I refuse to pay a house payment for health insurance. I'm not going to do it. But let me also tell you, I refuse to go uninsured and expose my family to bankruptcy. My wife doesn't deserve that. My children don't deserve that. So look, I saved nearly $700 per month the first year alone. And today, Obamacare, last I checked on healthcare.gov, it would run me $1,900 per month. I'm saving a fortune with this approach. But the question is for you, if you stopped gambling on traditional health insurance and you bought wholesale, as I discussed in Secret 1, and you did what I showed you in Secret 2, and you saved 60 to 80% on all your shoppable healthcare while using our advocates to lowering your cost and handling those claims when more than likely you're not going to be in the mood to do it, and you quickly built your nest egg of money with our banking product because of our huge matching principles on it, as I said in Secret 3. And look, and you finally had money to play offense. You had money to maintain great health, to age better, to avoid getting sick to begin with. Don't you think that's just a smarter, better way to handle your health care? I mean, I did. How many of you are excited about what you've heard today on this? How many of you are a little overwhelmed because I've covered so much in so little time? Look, it's impossible to go over everything in 20 minutes. And I see that my 20 minutes is up. So look, for those of you that are not interested in this concept, thank you so much for joining. I pray that you find the right solution for you. But just know this, look, for those of you that want a little bit more information, I have an irresistible offer that my partners and I have put together. And I just want to let you know, this is a recorded webinar. My partners are strong. And so, look, my irresistible offer, it's not on my website. It's not on my marketing materials. This proper offer, it's strictly available one time through the webinar only. It really kind of goes back to my cause. The only way that you're going to walk away from traditional health insurance safely and stop paying these skyrocketing premiums is that you must build your primary account first. That is the most important. It's the most likely that you're going to use, and you can't lose, guys. It's a banking product. It's not an insurance product. And so if you have a high deductible or you have no insurance, open up a bank account for all your first dollar costs. Look, you could start as low as $40 a month to build a $2,500 account. Or if you have a lot of health issues or a lot of non-traditional care needs, you can go straight to $60,000. I purchased the 25. It was in my budget. And besides, it was logical to me. You mean tell me I can put 10.6 in and at the end of the day have 25? Now, let me put a timeout here real quick. A lot of people tend to say, wait a second, how is the company allowing you to fund 10.6 and have 25, have almost 15,000 in match? Look, if this was a regular cash account where you could withdraw it to pay your electric bill and water bill and gas and all that, I would be on your side. You're right. There is absolutely no way they could do it. But remember, the money is strictly available for medical, dental, vision, elective procedures. And that's when you get the insurance principles involved. Okay, because the reality is only 20 to 30% of the population is going to use it at any one given time. Believe me, the product was designed by one of the most renowned actuarial firms in the nation. So anyway, we could talk more about that later. But look, for companies or individuals who love these brand name carriers, look, I know that sometimes having this in your wallet gives you a sense of, safety, and they're good, but here's the problem, or this is what I would say, is start paring down some of the primary care stuff with that, paring down some of the benefits. A lot of employers have put in supplemental insurance, AFLAC, and some of these carriers, another insurance, another gamble product. Instead of doing all that, offer proper, because here's my conservative plan. I know that once I get you to, let's say, $10,000, and it might take 2, 3, 4 years, but I know once I get you there, the way the product's designed, it's easy to get you to 20, and then to 30, and then to 40. And once you have that kind of money, you're empowered, guys. Your insurance cost now can be very little. And instead of your employer paying $700 to $1,000 a month to the insurance company on your behalf, ask them to put that in your paycheck. Ask them to put that into your 401k. I mean, how would an extra $700 to $1,000 a month help your family? Now, so here's the special offer. If you open up a bank account today, you're going to receive absolutely free 4 bonus offers. This is a one-time offer. Bonus number 1, telemedicine. You're going to have 24/7 access to a physician. It's one of the best things that healthcare has done. More times than not, you're going to get that prescription ordered over the phone. It's going to save you $100 to $200 every time you don't need to go to a doc in the box. So it's critical. Look, I used it, and it was a little nerve-wracking talking to a complete stranger, but man, when I could get my medicines immediately over the phone, it's a game changer. Okay, so bonus number 2 though is our wholesale drug company. So here's the card, like I said, that's my card. And so on the back, on the back we embed the bin number, the RX bin number. So you show that to your pharmacist, and now you're guaranteed to get wholesale pricing on all your medication. We beat GoodRx on a lot of the drugs. GoodRx beats us on some. So I would advise you to still have GoodRx on your smartphone and, look up the pricing. Bonus number 3, price transparency services. Folks, I thought long and hard about this, but look, I want you to be a better consumer. I want you to have this information. I want the medical community to compete for your dollars. And so in lieu of charging you $20 a month, which that's typically the fee, I'm going to waive that for the first year. I'm going to give that to you completely free. You're going to be the hero for your family because you'll let them know where to go to get the best and lowest price for the quality of care. Finally, bonus number 4 is our internal research. Now, Prater is a nationwide firm, but we know San Antonio. We know where the good deals are at for the good quality of care that's out there. We're also in thick with the naturopathic community, and so many of our members get special perks and privileges with the alternative medicine route. Now, let me just say this, guys. For most people, having money in your pocket, because that's what it's all about, and having these 4 bonuses is all you may ever need. I'm going to tell you, this is going to take care, money and some technology tools is going to take care of 85 to 90% of what you stress over. And you can get this for as little as $40 a month. Guys, I'm going to tell you, the bonuses alone are worth more than $40 a month. But finally, look, for those of you that don't have any health insurance and you like the concept of a nonprofit association and you want that advocate at your fingertips to help you negotiate bills, you want unlimited lab tests at zero copay. We have a relationship with Quest and Clinical Pathology Labs. You get to pick which one you want to work with. You get unlimited lab testing at zero copay. You want dental, vision, hearing discounts. You want roadside assistance. That's all available for $40 a month, $20 a child. Now, I believe the most important thing, though, the huge benefit of membership is that it unlocks or it allows you to buy policies on a wholesale level. And so you're able to buy that catastrophic policy for $54 for your family. Now, are you worried about the $50,000 deductible? I hear you, but we have that covered too. We have a wonderful hospital cancer policy that was specifically designed to pick up that first $50,000, and that product's $96. So look, as an adult, you add those up, it's $190 per month. That is a huge value compared to the marketplace now. You know, if you're 50 or 60 years old, those premiums are $1,000 a month. But here's the deal. If you want to wait until you suspect or that you have some serious issue, as a proper member, you can jump on these plans any first of the month without any health questions or without any pre-existing conditions. Look, I understand the logic that you don't buy a lawyer until you need a lawyer. You don't buy a mechanic until you need a mechanic. So why buy health insurance till you need health care? Well, with proper, you can do exactly that. You can buy it when you feel like you need it the most. So just in closing, look, if all proper did is that we provided you a means of being independent, we empowered you from renting expensive traditional health insurance, wouldn't that be worth joining proper? I mean, folks, I got to tell you, you're doubling your money and there's no risk involved in that. If all proper did was made you a better consumer of healthcare, we provided you technology tools, we provided you huge savings opportunities, wouldn't that be worth joining the proper family? And finally, and I think this is the most important one that hit me, if all proper did is it allowed you to budget for great health. It allowed you to nip those little issues as soon as they first arise. Because look, folks, if you have money in your pocket, you're more inclined to take care of these things. Look, I have seen grown men cry. I've cried with them when they ignored signs of ill health because they had a high deductible or they had no insurance at all or they had other priorities, so they just ignored it. And those little issues ended up being life-ending diagnosis. Stomach cancer, heart disease. Folks, start putting a little money aside for you. Allow us to match those dollars, have money when you need it the most. If you nip those issues as soon as they arise, you're going to be far better for it. Now, look, my ultimate goal is that I want you to spend money to avoid getting sick to begin with. You will enjoy proper health. Wouldn't that be worth joining the proper family? Look, all of our products are guaranteed. Our insurance has a 30-day right of review. Our bank product has a 20-day right of review. Click the button below. You'll fill out a quick little sales page. Tell us what you're trying to accomplish, maybe a little bit about what your scenario is. A proper rep will reach out to you in a way that you want to be reached out if you type it in. And hopefully we can help you out. Now, I've put some frequently asked questions below. Anyway, thank you so much for joining. I hope you click the button. I hope that we talk again. Thank you so much for your time.